An art therapy specialist, simply put, is a person who expresses and sees what is inside you. They help you bring out what's inside you, which is the subconscious or psychological disturbances. The doctor works with the person's conscious mind to bring out everything inside, then starts analyzing every detail they drew, even if it's just a scribble. To us, that scribble is a symbol we analyze. We understand and reach the person's inner psychological disturbances to see what they are. Then we start guiding them. If they are truly mentally ill or psychologically disturbed, or if they just need some release of negative energy, we might guide them to go to certain places where they can release their negative energy. So how do we do this? We do it by bringing either a child, a young person, an adult, or even elderly people some paper placed in front of them, God willing paper, pencil, colors, anything simple. This is placed in front of the child, the adult, or the person with a psychological problem, or even a physical illness like cancer or other chronic diseases. We give them paper, pencil, colors, brushes, any kind of drawing tools that allow them to express the negative feelings inside. The child or young person starts to draw things. We tell them to draw anything that comes to their mind. We don't tell them to draw something specific. Personally, in my workshops, I play certain music. This music triggers something inside that brings out the inner conscious mind while drawing. Of course, there are many types of music, and thankfully I've studied music therapy as well. So I know which music can bring out, or what type of music can bring out the conscious mind inside a person who has an art connection. It helps you bring out what's inside you. It's about things, symbols, things that the conscious mind produces. The person themselves may not know what these things they produce actually mean. For example, they might say, I'm very anxious, I feel suffocated, I feel like I'm always crying a lot, but they don't know what's wrong with them. We can't discover this issue from just 1 or 2 paintings or 3. The workshop or session consists of 12 sessions, and through these 12 sessions, we can uncover everything inside. We can identify what bothers them or what problem they are suffering from. Then, after identifying the problem, we can sit and talk with them a bit. We find out what is upsetting them, and then we solve the problem. If as art therapists we can't solve their problem, we should solve it through talking, by helping them release negative energy. We can communicate with the father or mother, whether it's a child. We act as a link between the person and the guardian, or the person responsible, or the person themselves, so that they can know what's inside. Very few people who come to me, whether children or whether they are psychiatric patients or not, they have a mental illness or disorder, of course. I can't diagnose this the first time. After the 2nd, 3rd, and 10th time, I confirm that he is mentally ill and not just psychologically ill. After that, I can confront him. Psychiatrists can take him and provide medication treatment. First, before he goes to a psychiatrist, he is referred to a doctor or psychologist, and then to a medical treatment doctor. A message directed to fathers and mothers. Unfortunately, when I talk to the father or mother and tell them their child is suffering from a psychological problem, the father and mother are often unable to tell the person or their child that they love him. Or the child is afraid to talk about the internal psychological disorders happening to him, especially if your child is being bullied at school, or is constantly subjected to bullying at school. He is unable to tell you, whether mother or father, what is happening to him. Plus, the father and mother themselves already have psychological disorders, and they beat the child severely, so the child is afraid even to speak or express himself. Here, I'll roll this first to